Hello, everyone. My name is Chad Royer, and this is my channel, What's Happening with Chad Y. Royer. And I'm documenting my journey as a cancer patient. I'm a little subdued, just a little bit, thinking of my friend Al. Uh, Al, if you're watching, I hope you're getting better. I'm going to pray for strength and healing coming your way. So now that I got that out the way, I just want to remind folks, if you would like to get more updates on my channel, please like the videos, subscribe to my channel, turn on to your notifications, and share my content with others you know. And hopefully we can help someone who's dealing with a cancer battle. Now, I wanted to just briefly show these words up here. Iberdomide, lenalidomide, which is also known as Revlimid. And I'm going to discuss those briefly in the video after, and I'm going to explain why I'm bringing this up. I wanted to go into some detail of how my bone marrow biopsy went. I had the bone marrow biopsy done twice, actually. I had it done recently, and the other time was in the hospital. But if you ask my opinion, I don't remember all the details involved on how it went because there was a lot going on. My pain threshold was pretty much shot, and I was dealing with a lot of uncertainty at the time. So in this case, what they do with the bone marrow biopsy is that they're getting a bone sample of marrow, and they're drilling through the skin with a needle, and they would drill to get a piece of the bone. And at times you hear that they're banging, so it feels like they're banging into the bone. And then they're trying to scoop some of the sample out. And it's somewhat bloody, but not to the point where I have blood all over my arm or my leg or anything. But in a sense, that's what they did. So what happened, they numbed my area. This was done in my pelvis. I was lying down on my stomach. They numbed the area for like about 2 minutes. They drilled a needle and something else to try to probe into the bone to get into the marrow. So once they were able to do that, they had to get enough of the bone marrow to create a sample where they can get data from the contents. So you're looking for presence of the cells where the bad cells are present, if they are, as well as the good cells. They had to take a little more than usual, and I'm going to explain that reason later. Apparently, my bone structure is very strong. So it took a while for them to drill. At first, I felt a pinch when they gave me the anesthesia. And when they drilled inside, it wasn't so painful, but I could feel the pressure. And at times, the pressure was almost unbearable, but not really. But something was in there. And that process took about 15 minutes. I was initially told about 10 minutes, but I realized that sometimes you have to give a margin of error for the work that they're doing, because sometimes you got to call an audible on the fly. And, that process was done. I had to lie on my back as they put a little bandage to try to stop the bleeding. I laid on my back for 2 to 3 minutes just to put pressure on the area so that the bleeding would stop. And then I was free to go. Now, based on these results of the bone marrow biopsy, this will determine my remission status. This, in conjunction with the echocardiogram that they took, the labs that they drew, they actually took about 16 vials of blood. And it was one of the procedures that they had to do. It escapes my mind for a minute. EKG, blood draw. Yeah, that's pretty much what they're going to need in order to find out my remission status. Now, there is a reason why there was extra bit of sample that was taken. So, ladies and gentlemen, I was asked if I wanted to take part in a clinical trial. And the drugs involved are, I'll show it here, iberdomide, which is a drug in experimentation right now, lenalidomide, also known as Revlimid, was something that I took a few months ago. These two drugs are in the same family. One of them, which is the iberdomide, has a short history from its experimental stage of showing fewer side effects than the lenalidomide. But in order for the drug to be approved, you need clinical trials where they try out the drug on some people. They look for feedback results and data from how the drug was used. And from what I understand, stage one of the trial was done already, where they already went over the safety and the effectiveness of the drug. So once it passed stage one, we can go into stage two, where they had to do more randomized trials to show that the iberdomide can be used as effective as, or maybe even better than, the Revlimid. And just from the studies, they haven't seen too many unexpected reactions from the iberdomide, where when they're used with other medicines. But some common uh, things that happen: skin rashes. I didn't get skin rash when I had when I was working with the Remdesivir. I did have fatigue. Another reaction could be a low blood count, a slight low blood count. Those are some common side effects. Uh, Ibutamide was used in prior trials with different cancers. I actually asked this question because I wanted to know a little more about the drug and what it entails. And you know, when I was using the Remdesivir, I was using a blood thinner. The blood thinner I was using was Xarelto, and that was in order to prevent any blood clots. You don't want to have a blood clot in the body because then you have to take extreme measures to try to fix that. Now, I could also use aspirin as a way of counteracting the blood clots. But for the purpose of the study, or actually, this might be the actual protocol outside of the clinical trial, but I would be using Xarelto for about 6 months to a year. And then after that, I may not have to use the Xarelto. Uh, the Xarelto and the Remdesivir, they kind of work hand in hand to prevent blood clots. Now, one thing that they test for before you get into the maintenance phase of the medicines that you're taking. So in my case, if I'm in remission, My next step is the maintenance phase. That's where we're maintaining the work that we did to kill off the bad cells in the body, where you're just taking pills on occasion every month. So in my case, it looks like I will either be using the iburamide or the Remlivid in the clinical trial. How that gets decided is random selection. I won't know until I'm told randomly what that drug will be. And if it just so happens that in the course of 2 to 3 years, my MRE tests negative. So, what the MRE is the minimal residual disease counts. If it shows that after taking another bone marrow biopsy and is little to no trace of the cancer in the blood, then I may not need to go further with the maintenance phase after 2 to 3 years, maybe 4 years. That can be detected by also an MRE scan. But in this case, they use the bone marrow biopsy. Another thing to keep in mind, in my case, if I am to go forth with the clinical trial, uh, the timeline is approximately 4 years, unless they call off the study for whatever reason. It could be maybe the FDA approved the drug, maybe there was a health setback that I had to go through, maybe the doctor saw something where I might have to discontinue, or maybe I'm reporting something where I feel I may have to discontinue. And every cycle is equivalent to 28 days. There are 26 cycles. So for each cycle, I will be on either one of the drug for 3 weeks. Then I will cycle off for 1 week. That constitutes one cycle. The next cycle, I'm on the drug for 3 weeks. Then I'm off for the fourth week. That's cycle two. Then it continues for up to 26 months. Now, again, for any reason, that can change, but for now, that's what the clinical trial is looking like. And I've accepted going forth with it. If I was not to go forth with the clinical trial, I would be on the Remlivid medicine as the course of action going forth to try to maintain the health standard that I have right now. And this is new to me, but I guess one of the reasons why I was approached to take part in a clinical study is because I tested well in many of the areas throughout the process. And I hope that my help and assistance with the clinical trial helps other cancer patients as they have to navigate their road to being cancer free. Hopefully, something can be developed beyond this trial. Hopefully, the drug can be approved with the right information. Hopefully, someone can be helped in the event that they're not able to use Remlivid for whatever health reason. I'm just hoping for the greater good to be served. Uh, I know that's a lot. I'm sharing this for the first time. I just found out this information about a week ago. I was presented with the opportunity. I had some time to think about it. I did some research. I asked some questions. And from what I've gone through, I'm ready to go forth until something happens in the middle. And let's see how it goes. Let's see how it goes. That's all I have for now. I do have some other information coming up soon. Stay tuned. I hope to get some information on my remission status sooner or later. But In no way am I done with this battle. I still have a fight to fight, and I'm in it for the long run. So, folks, thank you for joining. If you haven't done so, please like the videos. Please leave a comment or two. Please subscribe to the videos. Please subscribe to the channel, excuse me, so that you can get more information on when videos are coming. And I hope to see you all soon on the next one. Take care. Be well.